Good afternoon. Thank you for watching Shell Gone Rogue. This is a channel I created to be a safe zone for Black women and to help us lead a authentic life and lead us to happiness, health, and peace. This channel is to basically help women simply slay life. Today, I have someone on that I thank her so much for taking the time to come and spend and talk with us about something I consider very precious to me, which is healthcare, especially in the Black community. I'm going to let her introduce herself and give us a little background about her. Um, please welcome Dr. Abdul.
Hello, everyone. Good afternoon. If you're listening to this or watching this, in the afternoon, whatever time of day. My name is Moya Salah Abdul. I'm a physician. Internal medicine is my specialty. I've been practicing for about 2 years. I've actually been in healthcare for much longer than that, but specifically a physician. I've been practicing internal medicine for about 2 years. It's a field of medicine that I'm very excited to be in. It interests me a lot because of the breadth of disease processes that we're exposed to. I'm not a specialist. However, I do see a myriad of disease processes and have pretty much good knowledge on a wide array of disease processes. So um, that's my specialty, and that's what I focus on. And I'm very excited to be here today and to be talking with Ms. Rochelle about something she's very passionate about, and I'm also very passionate about myself. And so hopefully, the, our discussions can lead to some changes in people and impact people in a positive way today.
Thank you so much for that. So we're going to go ahead and just dive right in. I do have some questions that I've written out and everything, and then I'll go ahead and also let you tell us what you see on the forefront in your field that can kind of help us to be aware of. So if you see me looking down, that's because I'm looking at my notes, but you have my undivided attention.
Sure.
Um, so my first question for you is, are there any specific preventable measures that Black women should take to maintain their health?
Absolutely. So depending on your age range, and I'm sure most of the women who are probably or people who are probably watching this video or watching that watch your channel are middle-aged women, Black women. There are specific screening recommendations that are in place for women, um, that like I said, based on your age, your physician may recommend them. Um,
Mhm.
so for women, typically the cancer screening, such as colorectal cancer screening, breast cancer screening. Also, something that a lot of people don't really talk about is lung cancer screening. And typically that's geared towards people who are at risk. So if you have, obviously, if you have a long smoking history, that's something that people don't really talk about. A lot of people don't know about. I like to take it a step further. I'm not a primary care physician. I'm actually a hospitalist. I practice primarily in the hospital, but I do have some exposure to primary care. Um, I recommend that people who are exposed, actually secondhand smoke, can also uh, add risk of lung cancer that people often don't think about because it's passive. Um, also cervical cancer screening, if I haven't mentioned that, for women, starting at age 21 through age 65. I mean, actually, it breaks it down to um, starting at the age of 21. Cervical cancer screening is recommended every 3 years, of course, if your results are normal. And that screening is only tests for abnormal cells. It doesn't test for human papillomavirus, which is a virus that is commonly linked with cervical cancer. Starting at age 30, actually, you do have the option of doing HPV, human papillomavirus screening, in addition to the cytology, which, as I said, tests for abnormal cells. So that tests for the virus and abnormal cells. And depending on your results, that widens the interval to 5 years. So instead of checking every 3 years, you just have to check every 5 years. And so that's recommended typically for women from the age of 30 to age 65.
Okay.
Another, yes.
Uh-huh. No, go ahead. I'll
Oh,
come back
okay.
to my
I should have
question with
questions
that.
about that.
Uh-huh.
So, typically a lot of some of the other, I guess, more commonly known screenings, of course, screening for diabetes and prediabetes, that's actually recommended starting at the age of 35 for people who are overweight, considered overweight. Um,
Okay.
and so you also have hepatitis B screening, hepatitis C screening, depending
Hmm.
on your risk factors, and then HIV screening, which a lot of people don't talk about unless it's something that, they feel they've been exposed to or they know they've been exposed to. Um, actually, and a lot of these recommendations, I'll preface this by saying they come from the United States Preventative Task Force, which is a governing body that pretty much guides primary care and kind of makes recommendations. And as I said, they're recommendations. They're not hard and fast rules. They don't have to be abided by. They're just strictly recommendations. And later on during our discussion, I'll kind of talk about some of my personal opinions about some of the guidelines and recommendations.
Okay.
But just on a surface level, these are some of the recommendations that they have put forth based on trends and based on evidence-based medicine. Um, I think I was talking about the HIV screening. Yeah, that's recommended starting at the age of 15 to up to the age of 65, at least one time. So
Okay.
those are some of the recommendations that I feel also specifically apply to Black women and would be helpful in terms of um, preventative medicine.
Okay. So now I want to go back some when you were talking about the um the cervical cancer and the HPV and things like that. Now,
Sure.
are those I mean, I know you're not an OB/GYN or anything. I know you do internal medicine, but
Mhm,
are those things that are part? Because I don't remember. I mean, I just had a pap
mhm,
smear.
mhm.
I don't, is that part of the normal pap smear? Or is that something we should be asking our gen doctors?
So most
Or,
likely, as I said, if you're over the age of 30, that was included, and maybe your
oh,
OB/GYN probably
okay.
didn't discuss it with you, but typically
Right.
that's included,
Okay.
co-testing HPV as well as the cytology. So as I said, the cytology is simply going to give you the abnormal, show you if there are abnormal cells.
Right.
It won't test for the virus, but the
Okay.
HPV screening or the HPV test will test for the virus as well.
Right. Because normally we just get the answer. I don't, normally,
It's
as most
negative,
of
and
us,
you're
we
like,
don't know
"Oh, I'm
what's all
happy."
included in the text.
Yeah,
They just say, you're fine. And you're like,
right.
okay. So you don't know what's all included. So that's
Yeah.
good to know.
Mhm.
Now I thought that it was also interesting that you said that by the age of, they start testing like for HIV by the age of 15, all the way up to 65. Now, should that be, do you know, maybe like as that make that part of your yearly women exam? Besides, when I know it only comes up most time when people think they've been exposed to it.
Right.
But if you're going for your annual well woman's or whatever,
Mhm.
may do you think that may be a good idea to say, no, just do the whole battery of tests, just do the full,
Yeah,
or
so
can you
in
suggest
terms
on that?
of doing a battery of tests, I'm glad you mentioned that term.
Mhm.
In terms of cost-effective medicine, it's not necessarily, obviously, ideally, in a perfect world, if we had unlimited resources, we would hope to be able to
Right,
test for everything under the sun. But obviously, that's not the case in terms of resource allocation and things like that. But I do recommend that, you have a shared discussion with your provider, your physician,
you're
your
right,
OB/GYN, if that's who you're discussing this with, or your primary care doctor, and obviously, that will spur a conversation about, behaviors and risk factors and things like that. And that will guide the conversation. But of course, I'm a huge advocate of people advocating for their health. And so if
hmm
you feel very, very strongly and compelled about having that test done, then absolutely you have every right as a patient, as a consumer of medicine, to request that.
okay. Well, I'm a big advocate of it anyway, especially, people want to pretend like, oh, safe sex. I practice it. Some people don't. Once they get in a relationship. But if when you meet new partners, or at least every 6 months, you need to be. That's just my view. That you need to be trying to get a test, because not everybody, who say they faithful or things come out down the line, just to be protective of yourself. This is my comments, not Dr. Abdul. So, I'm a very
I
big
don't
advocate of
disagree.
stuff like that. I'm okay. I didn't want to put words in your mouth though.
Mhm.
Okay, so my next question from there is, um, can you discuss the role that diet and lifestyle plays in the health of Black women?
Yes. So, I was thinking about this the other, actually, I think about this very often. And
Hmm.
I was thinking about historically what role, like how ingrained our food is in our culture, in our day-to-day
Right,
life, just as Americans and specifically as Black people throughout the diaspora, right?
right,
Culture is such, I mean, food is such a big part of our culture, and it's such a huge part of our existence. And, unfortunately, specifically in this country, with Black people in the history, obviously we don't need to go down memory lane and talk about, history specifically with regard to Black people, but just to reference it, um, there have been a lot of bad, I mean, I guess I'll use that word, be frank. There have been a lot of bad practices that have been passed down from generation to
right,
generation and have been considered culture for Black people. And not
right.
to demonize it or to talk down on some of the cultural practices, but they've been pretty much as a result of survival, a way to
Right.
survive. And unfortunately, because of that, a lot of Black people have not been educated on nutrition,
Right.
and it does play a huge role in our health as a
Hmm.
people. Um, in addition to that, there are also other socioeconomic factors that play into diet.
Right.
Specifically, one thing that I'm very passionate about, and one topic I'm very passionate about that a lot of people aren't aware of, are food deserts. So,
Hmm.
you have food deserts throughout this country. We talk about how this country is developed, and we're a powerhouse, and yet you have numerous counties, states, cities that have food deserts. And for
Right.
some of the listeners who may not be familiar with what a food desert is, it's basically an area where the inhabitants of the area don't have access to grocery stores, or don't have access to grocery stores that carry fresh produce. So you'll
Right.
see a lot of fast food, processed food, but you won't see areas where they can go and get fruits and vegetables and fresh,
Mhm.
fresh meats, fish, other sources of protein that they can cook at home. So then they're relegated to this cycle of consuming, foods high in fat, high in sugar, high in, trans fats, basically processed food, fast food. And that obviously spurs, it's like a cycle of
Hmm.
unhealthy habits that they live with and generations on generations continue to have. So, leading back to the original question, to answer your question, the role of diet specifically, um, and lifestyle, they go hand in hand, in my opinion. We can talk about lifestyle, we can talk about exercise and things like that. It
Right.
all is encompassing, and it they're the it's multifactorial, and it's
Hmm.
not a one answer question.
Right.
There are different factors that interact with each other, and they all lead to, unfortunately, when it's poor lifestyle, poor diet, they all lead to poor
Right.
outcomes with regard to health. So from my advice, or I guess I won't say advice, but I'll say my comment on it is that the most important thing, or one of the most important things, or I get at least a starting point, is for Black women to educate themselves on what are healthy eating habits, what are healthy
Mhm.
lifestyle habits, and then go from there. And that's easier said than done. For instance, if you live in
Right.
an area where there's a food desert and you have to, you know, commute, or you have to travel, 15, 20 miles just to get, um, lettuce or carrots or,
Right.
cucumbers, and you have 3 kids to feed, and you have all these other things, you have a job and you work 60 hours a week, it's not always practical to do that.
Right.
So there we a lot of people like to talk about personal accountability, and that's very important. But I think
Hmm.
as a whole, our society, and specifically I'll say our government bodies, need to do a better job of
Yes.
providing, these resources for people to be able to make these healthy
Right.
choices. You'd be amazed at what people know and don't know.
Right.
During my training, I actually trained in a rural area, and I'll tell you the demographics briefly. Basically, uh, 1/3 of the population were Native Americans, 1/3 were African Americans, and 1/3 were Caucasians. And
Hmm.
I was amazed at the number of patients that I saw that told me that they don't drink water every day. Now, that might
Mm.
sound foreign. That might sound outrageous. It might sound like I'm making it up, but I kid you not. I was amazed. Like it opened my eyes to, health literacy and other things.
Right.
People, I had patients who we would have like I never thought I'd be having to have that discussion because I just thought it was innate. You're supposed to drink water, right? You're supposed to drink what,
Right.
64 ounces a day. But I had patients that would tell me that they don't drink water.
Mm-hmm.
And I was dumbfounded. I was like, this is actually a thing. These people don't drink water. I'm like, so what do you drink? Oh, well, I drink sweet tea, I drink milk, I drink
Mm-hmm.
soda, but I don't drink water.
Yeah. I've
Water?
heard that where definitely people were like, as long as you're getting fluids in. And I was like, it's not the same. It's not the same. So I've heard that. I've definitely heard that.
So,
Um,
yeah.
I have a family member that's basically like, well, they'll do lemon water, but they put in a little bit of like a sweet low packet or something. And I'm like, that's lemonade. You know, make whole lemon, not water. But I'm at least need you to drink 4 glasses a day or something like that. So I get what you're talking about. It's a lot of people that think like that. Um, and that is one of the things I know when I came through school and elementary and stuff, you had the food pyramid and they really practiced that and you know, I know it's changed over the years.
Mhm,
But that was part of you grew up as 8 glasses of water a day. These are your things you're supposed to have and to exchange. I know the starch exchange version.
mhm.
If I'm telling my age, I know they call it something else now, the carbohydrate exchange, I believe is what they but when I was coming through, it was the starch exchange, and what that is, and that the potatoes and the rice can be exchanged out, and peas and carrots actually
Yeah.
fall into a starch and not a
Mhm,
vegetable technically, and
mhm,
you know, and I think they do need to bring stuff like that back in school, and make it part of, and only sometimes that when people maybe are listed as maybe diabetic and stuff, do they offer that education to them? Like, you're supposed to take that nutrition class with them so that they know what they're
mhm.
supposed to do. But I think that in general, maybe bring that back into school so people honestly know as kids starting young till they get in a habit. You know, um, I've also know that like even certain, I'm in Houston, so definitely around certain parts of Houston, there's big food deserts, if you're not in the right area. And so when you have the little mom and pop grocery or the convenience store that sells a little bit of everything in there, if you can't get fresh food, at least way we were brought up was like if you can't get fresh all the time, at least get the frozen because yes, it doesn't have as many nutrients, but
Mhm.
it's better than the can. You
Right.
know, if you get the can, at least try to rinse it off because it has high preservatives and
So,
high
yeah,
sodium,
right.
which kind of also for us as most blacks, we have a high level, and you probably can speak more on this than I can, a high risk of high blood pressure and high cholesterol
Yeah,
and stuff based on our eating factors also and our genetic makeup too, that we run the biggest risk of those things.
right.
So even if you can't get frozen or fresh, if you have to buy can, please rinse it off because it's like it has the preservatives or sodium,
Yeah.
too, that people
Mhm.
sometimes don't correlate those as the same thing.
Yeah.
Um, and so for me, I want to ask, like, for as I know that as a black woman, we all are spouses or, or sisters to brothers and mothers to sons. What are some of the things that we can pay attention to look out for our male family members and our
Mhm.
male friends that you kind of peep and be like, oh, I think you may want to go to the doctor for that, or you may want to go visit because something seems off that we just normally we don't pay it, they may not pay attention to, but we
Mhm.
could be on the lookout for as a loving, caring family member.
Yeah, absolutely. So, just to give you some statistics, and then I'll talk more anecdotally about,
Mhm.
just, everyday things that we might not pay attention to that should be something that we should be paying attention to.
Right.
So, based on um, the CDC's statistics, so about 45% of Black men suffer from hypertension. And that number, about 35% suffer from obesity. And those numbers, those stats of Black women are much higher, unfortunately. And we'll talk about that later, possibly. But, you know, Black men in general, I can speak to this personally, they tend to ignore and they tend to
Right,
trivialize a lot of things with regard to
right.
their health. They are less likely to go and get physicals yearly. They're less likely to
Mhm.
go and get routine screening. Some of the cancer screens that I mentioned earlier, such as lung,
Mhm.
colon, prostate, and actually they've actually changed their recommendations for
Right.
colon cancer screening for um, Black men from age 50
Mhm.
to start at age 45 because they're finding that a lot of the colon cancers that they're diagnosing are more aggressive, and they're finding that they probably would have had a better outcome if they would have been caught sooner. So just encouraging, the male family members or male loved ones in our lives to, go for their routine screenings. As far as prostate cancer, it's an interesting one because the recommendations have changed over the years so much. First, they recommend PSA screening yearly, then they don't. Then they say it leads to more unnecessary testing and a lot of false negatives. Again, that's another one where I would say based on your family history, based on your risk factors, I would say have a shared decision making conversation with your primary care doctor as far as testing for PSA. And PSA is the prostate specific antigen. And it's basically a protein that the prostate produces that there are normal levels, and anything above normal needs to be investigated further for possible prostate cancer. There are other things that can cause it to be elevated, but obviously, the most deleterious cause would be prostate cancer. But yeah, just encouraging them to make sure that they go for their yearly physical, obviously encouraging them to practice healthy habits such as exercise, regular exercise, consuming fresh fruits and vegetables, laying off of the fast foods, staying, decreasing their alcohol intake, stop smoking, don't smoke at all. I would recommend that, but I know that's not practical. And just being their advocate, even if they aren't theirs, because again, men tend to put off a lot of things, unfortunately. And so a lot of the times, they've actually done studies that show that men who have women in their lives, a partner, a spouse, actually have live longer than single
Right.
men. So that's just, a little aside, but I don't have the numbers, but I do know that there's a study that has proven that.
Yeah, I've
But
heard
yeah,
that too.
some of
I've
those
heard
things.
that too.
And then another
Yeah.
thing that I wanted to mention that a lot of
Hmm.
people don't realize is sleep apnea. So
Hmm.
when you have a partner, when you have a husband or boyfriend or whatever your case, your situation is, that snores a lot.
Hmm.
People think it's something funny and, it's just this annoying thing that disrupts the sleep, but that could be actually a sign of something pathological going on, such as sleep apnea, which is a condition. It's a sleep disorder, basically for throughout the night, throughout whatever period of time you're sleeping for, whether it's 8 hours or 10 hours, you stop breathing for seconds. And that might not sound like a lot, but over time and over years, that's oxygen that's not being delivered to your vital organs, and that can cause a lot of health problems. Some of the heart disease, diabetes, hypertension, that is like a number one, you know, un, undiagnosed cause of hypertension. Because a lot of people look at hypertension like it's a disease process on its own, but a lot of times it's a secondary manifestation of something else going on. So a lot of people live years with untreated, undiagnosed sleep apnea that's causing their blood pressure to be high or causing their diabetes to actually be present or even be uncontrolled. Some people with a heart condition, irregular heart rhythm called atrial fibrillation, the cause is sleep apnea. So that's another one that I just wanted to mention that a lot of people don't cue into and just don't think much of it. Like, oh, he just snores. He's a loud snorer.
Yeah.
Maybe he's snoring because he has sleep apnea, and maybe he needs to be screened for that. So that's another one that a lot of women, or not just women, men and women, could look out
Right.
for in their partners to see, hey, my wife snores a lot, and sometimes she'll stop breathing. I don't know what's that. That's something to pay attention to and to investigate further.
And I thank you for bringing that up because a lot of people I know, especially with sleep apnea, they don't even associate that that may be a trigger to from something else that is, that it leads to other things or makes things
Mhm.
worse. People
Mhm.
just end up thinking, oh, that's why I'm snoring, and that's all they relate it to. They
Mhm.
don't think that it can also be a backdrop from something, to something or from something. So that's good to know. Um, one of my questions is also, how can healthcare providers better address the healthcare needs of, I was going to say toward Black women, but
Mhm.
I want to more generalize it to the
Mhm.
Black family or the Black community then, um, to kind of help us get an understanding about our health.
Yeah, so the number one thing, the first thing I'll say is listen to your patients. Listen to your patients. Don't assume that I mean, obviously we're physicians. We know
Right.
we've we've studied medicine for an extended period of time to have a base of knowledge, but we don't know everything. Unfortunately, a lot of us don't like to admit it, but we don't know everything. And there's so much value in truly listening to your patients. And unfortunately, the way that healthcare is set up in this country as of
Right.
late, it's very difficult to devote the time that a lot of patients need,
Hmm.
or the amount of time that they need and the amount of time that they expect. But in general, it's very important to listen to your patients and to leave all preconceived notions at the door when you're dealing with patients. And I say that because I actually did a presentation when I was in residency on implicit bias and how it
Mm,
affects the delivery of healthcare. And unfortunately, I've experienced it myself. I've
right.
witnessed it numerous times, more times than I would have wanted to.
Right.
But that does affect the way that healthcare is delivered and the outcomes ultimately. Um, so I think a lot of healthcare providers need to be more in tune with um, listening to their patients and also being aware of some of the ailments and some of the you know we kind of well we haven't discussed it yet. I don't know if we will, but um
Mm.
some of the social determinants of health that affect outcomes and some of the things
Yes.
that might, it's not just about, okay, this patient has this disease process and I've explained it to them and this is the treatment and this is what we're doing. Well, unfortunately, medicine is not always one size fits all. Sometimes
Right.
certain things may be a factor that will impede having the intended outcome for this patient. And maybe that's something that we need to investigate further so that we can better serve them and ultimately lead them to their optimal level of health. So that's the number one thing I would say is healthcare providers definitely need to listen to their patients and specifically their Black patients um, in this instance, because a lot of times things fall through the cracks because there is that disconnect between what the patient is telling you and what you think and objectively what you're
Right.
seeing in the labs and your assumptions based on that.
Mm. I, I I definitely know what you're talking about. Especially when it relates to that. It happened to me a couple of weeks ago. Then
Mhm.
I was just like, and because of the field that I work in and where I work at, I don't have any other choice but to use those set of doctors.
Mhm. Mhm.
Because my company is we can only use that particular people. But I was so livid
Mhm.
that I was like, any other time, oh, you're not listening. Let me go this way. I'll go to
Mhm.
somebody
Mhm.
because you're not paying attention to what I'm
Mhm.
saying.
Mhm.
And because I have like a major surgery coming up,
Mhm.
and he's the specialist that specializes in this thing,
Mhm.
and I'm stuck with him
Mhm.
because for that specific location, he's the one that specializes in that surgery.
Mhm.
And it was a bias. He heard something, even though his comprehension was, I'm not saying I don't know, but what he may have misunderstood or where there was a misunderstanding somewhere in our conversation.
Mhm.
It literally turned into he accused me. of something, which made
Mm,
me upset, which that's not what I
mm,
was saying.
mhm.
And I was just like, people who you're not listening, you're not listening to what I'm saying.
Yeah.
And I'm like, my mom was a nurse for 45 years.
Mm,
And I remember a long time ago, she told me, be careful with your when you're talking to some people because people get things automatically in their head and then they put you as being combative or being I forget the other word she says, like non-responsive or like a
non-compliant.
difficult patient. Yes, that's
Mhm,
the word,
mhm,
non-compliant. And so she says, so sometimes you have to back down because and I felt she says, oh, don't go back there because they've already wrote you up like that. And
mm,
you won't get what you need. And so for me to be in a situation where I'm like, I'm stuck in this,
mm,
and um, but for the most part, I can say, some of the better doctors I've have experienced, they do take the time but every once in a while you get somebody. So
mhm,
I'm happy that you do mention about people, please pay attention because maybe I didn't say it right. Maybe I didn't explain it right because I don't know what word, I'm supposed to be using for you to comprehend, you
mhm.
know, or vice versa. Maybe you're saying to me, it may be over that person's head. And so there's a miscommunication and then it comes off as it makes the situations way worse because I was like, by the time I
Mm,
left the doctor's office and I was like, okay, I guess but it was like I have a major, he has to do surgery on my eye, and I was like,
mhm,
we're not saying nothing until he gets out my eye,
mm.
and that's just
Yeah.
like, uh, you know, um, if it was something as simple as a basic, oh, we're going in, like I'm having laser surgery to get rid of these glasses, okay, maybe I could find somebody else, but I have bleeding going on behind my eye. And so
Mm,
he has to go in and take care of that. And so
yeah.
I'm like, and he's the one for that facility that's his specialty, this particular
Mm,
surgery. And I immediately my anxiety came on for that fear. And I said,
mm,
that's so horrible. So I thank you for touching base on, even just from a medical standpoint, vice versa. Patients, talk it through with your doctors, but also, doctors, nurse practitioners, PAs, all the above, make sure y'all are listening and getting a full understanding. I know most of the time their time is short. We look up if we can get 20 minutes because they have so many they have to go through in the
yeah.
day. And I understand that, and it may have a lot to do with the field that I'm into. I
Mhm,
mean, being in a healthcare setting, that I may understand better than others, but it goes both ways. Please make sure you're trying to either go in with a list of questions to ask your doctor,
mhm,
so that you're not forgetting. And for the doctor to be able to say, if I miss something, contact my nurse or contact my coordinator and send me an email, something so we can follow up so that there's a good conversation taking place.
yes.
I did want to hit on because you brought it up. Um, it was the social determinants
Mhm.
that you said that you wanted to talk. So that was one of my questions. Um, can you expand on that a little bit more?
Yeah. So, for your viewers and listeners, just a refresher and just make sure we have definitions in place. So, social determinants of health are simply non-medical factors that determine health outcomes. So, the things that are um, out of our direct control. When I say our, I mean healthcare providers, doctors, that do affect outcomes. And so, ultimately, as physicians, as healthcare providers, our goal is to get people to their optimal level of health. And we do our part as far as diagnosing, educating, treating, managing, but that doesn't guarantee that we get the intended outcome. And we have to understand and recognize that those factors that are outside of although they may be outside of our control, we can still be advocates and we can still educate ourselves enough to be able to influence those factors in some ways. So examples are access to healthcare, education level, income, geographic location, employment. As we mentioned briefly, food security that goes along with the food desert conversation. Um, you know, living with a partner, having a spouse, having family support, And then, of course, I mentioned access to healthcare, but insurance access. So all of those, some of those factors, most of those factors, they they contribute to health outcomes. And we as providers have to recognize, again, like I said, that, we can't just be, this singular force and saying, okay, I'm the doctor, I've done my part, I'm walking away. We have to also interact with that level. Now, we can't always fix everything. Obviously, in this, I use the example of employment or income. I can't change my patient's income level or, whether or not they're employed, but I can understand that there may be some factors that will limit, their access to funds or resources, and try to facilitate, maybe make recommendations to social services, or, come up with discount cards, have, somebody in some department somewhere who specializes in those areas, coordinate with that patient to get them the resources that they need to be able to get the medications that they need, or whatever treatment that they need to be able to manage whatever disease process they have. So, yeah.
Okay. And then my final question, and then I'm going to let you have the platform so you can discuss things that you see that truly affect the Black community for us to be
Mhm,
aware of.
mhm.
My question is, for my final question, is can you discuss any recent advancements or research um, in internal medicine that has certainly that is certainly relevant to Black women or the Black community?
So, research is not my area of
Mhm,
specialty, but one thing I'll say is that one area of medicine that I actually take a particular interest in is pharmacogenetics. And what
okay.
that is basically um, looking at the genome and individuals'
Mhm,
genomes and seeing how. So, when you go to the doctor, you tell them, "Hey, doctor, I'm having a lot of pain in my shoulder. It's been going on for about 2 months, and it's really achy and this and that." And, the doctor will look and say, "Hey, let's do an X-ray. Let's see what's going on there." And they'll say, "Okay, your X-ray shows you have some arthritis, so we're going to prescribe you, naproxen, or we're going to prescribe you, Toradol or Tramadol or something, some medication, right? Let's say it's not over the counter; it's actually prescribed." And that's, generally speaking, the medication of choice that works for most patients. Well, every patient is different, every body is different. And pharmacogenetics, what it looks at is how how does genetics play a factor in the efficacy of medications, certain medications. And so certain gene traits, certain traits predispose you to, responding well to that medication versus not that medication, or even having side effects to that medication or not having side effects to medication. So, in a perfect world, which we do not live in, obviously, um, a doctor or healthcare provider will be able to have that information at their disposal at the time of treatment and say, you know what, I'm not even going to try, because we've all been, well, a lot of us have been there where, your doctor prescribes this medication and then it doesn't work. And they're like, okay, we're going to try the next medication. Okay, we're going to try the next one. Maybe this won't work. And it's kind of like a trial or error situation, and not really trial or error, but basically that's how it's perceived based on the outcome or the results.
mhm,
So in a perfect world, we'd have this information at our disposal to say, okay, based on this patient or this person's genome, I know for with certainty that if I prescribe this medication, it's not going to work for them. So let me not even waste their time. Let me not waste my time. Let's go straight to this medication that's been proven based on their genome, that they will respond well to, they were less likely to have side effects to, and that's the treatment of choice for that particular patient. That's something that, in a perfect world, I would have access to as a doctor, and I'd be able to treat my patients with relative ease. But though that's obviously in development, it's not a perfect science just yet. A lot of it's obviously not cost effective at this stage, and it's not something that a lot of people have access to. It's more in the research world. It hasn't been implemented in practice yet, but that's something that I think would be very helpful. Um, for treating patients, and specifically Black people, Black women, pretty much everybody.
okay. So before we wrap this up, I'm going to let you have the floor so that you can talk about what do you feel is important, in the community or just in general, especially when
Mhm.
it comes to healthcare?
Okay. Well, just in general, I think it's very important for Black people to, again, advocate for themselves. For us, we need to advocate for us. I mean, I went into medicine in order to take care of people, but specifically to take care of my community. And I think, any chance I get when I'm treating patients in the hospital, I'm always, making sure that I'm educating them and I'm making sure that they know that they do have power on some level. Don't feel like you're powerless. You're your best advocate no matter what, and you know your body better than anybody. You may not have the knowledge, the medical knowledge, you may not have the medical terminology, but you know your body more than anybody. And it's very important that we're our own advocates because as we kind of discussed and we briefly touched upon during our discussion this afternoon, a lot of things can fall through the cracks, and so we have to be that forefront. We have to be that person that's like, "Hey, something doesn't seem right. I don't think this is the case, doc. I don't, this is what I've been feeling." So that's number one is to be our own self advocates. Another thing is, I really feel that a lot of the chronic diseases that we suffer from as a community, a lot of it is we have to take accountability. Basically, we need to take control and take accountability for our own health, in order for us to have better outcomes, a longer life expectancy, to be here for our children, our grandchildren, and generations to come. I see so many, people in the community that, you talk about so and so died at the age of 52, so and so died at the age of 48, and you're like, what happened? Oh, they had kidney disease, oh, they had diabetes, and you're like, wait, what? At 48, at 52, and obviously, if you look at it from a spiritual perspective, you can say it was their time, and we're not going to get into that, but just more specifically looking at mortality rates and things like that, it breaks my heart to see, and I just feel that we could do better for each other and for ourselves and for our children and our children's children to take charge of our health and take our health very seriously. And my mom used to always ingrain this in my head, and it's so interesting how now, at the age I'm at, it's finally kicking in and it's finally registering. She's like, "Health is wealth." And it's
Right,
so true. Health is truly wealth. And, obviously, we're all not dealt the same cards, right? So
right,
there's some people who have genetic conditions that they have no control over. In your case, autoimmune diseases that you had no control over,
right,
victim of circumstance. But for some of these things that are easily preventable, I feel like we should take charge of our health and try our best in our daily lives to make better choices, whether that means going for a walk for 30 minutes every day, just a walk, whether that means deciding, what, I'm not going to go to McDonald's today. I'm going to decide to eat a carrot instead of, getting a Big Mac, just making smart choices for the long run. And so that those things I think are very, very important to me, and I try to stress that to people, in any way that I can. I mean, I'm not saying we all indulge every now and then, right? Like,
you're right.
personally, one of my vices is sweets, okay? So I'm working on it,
Yeah,
trying to make changes here and there, but, in general, I think we owe it to ourselves, we owe it to our community in order to strengthen our community. Our health has to be on point. And
right,
we talk about all of these other factors, all of these other things that need to change in the community. But if we don't have our health intact, then all those other things become obsolete.
right. Okay. Well, I thank you for taking the time out today to have this discussion with us. And I hope you come by and visit us again. Hopefully,
Sure.
I'll have some comments for you, and some questions that maybe the audience decided to send us.
Okay.
But I thank you so much for taking the time for us to have a better understanding of things that we can do, to assist ourselves in healthcare and assist ourselves to be more healthy. Um, and I thank everybody for taking the time out to watch Shell Gone Rogue. If you like this discussion, please hit the share and subscribe button and be sure to like it also. Thank y'all for watching Shell Gone Rogue, and thank you, Dr. Abdul, for joining us today. Y'all have a good day.
It was my pleasure. Thank you so much. Take care.
All right, you too. Bye bye.